So far in this chapter, we have learned about the structure of kidneys, the structure and function of a nephron, how glomerular filtration takes place, and how these structures help in osmoregulation. But what happens if these systems fail? What happens to the body? In this video, let's look at what happens when the excretory system doesn't function as it's supposed to. So, the first scenario that we are faced with is when the kidneys malfunction. So, what does that mean? It means the kidney is not doing the functions it's supposed to do. It leads to a condition which is called as uremia, which means there is an increase in the amount of urea in the blood. Notice how I say increase in the amount of urea in the blood and not just the presence of urea in the blood. That's because body actually retains some of the urea to maintain osmolarity. The normal level of urea in our blood is roughly 7 to 20 milligram per deciliter. Now, when this goes beyond this particular level for an extended period of time, we can conclude that our kidneys are failing. The reason for kidney malfunctions could be many, but the primary reason is high blood pressure. We know that kidney filtration occurs because of certain pressures that work together within the kidneys. But when your body operates at a higher pressure for a longer period of time, that can damage the filtering structures within the kidney. So, how do we treat this condition? There are two ways in which we can manage this. One is a temporary measure, which is called as dialysis, which is termed as an artificial kidney. So it looks something like this. So, very simply put, we take the blood out from a patient's body, run it through the dialysing machine where it removes urea, and then we put the blood back into the patient's body. Although it sounds very simple, it is not. We have already discussed regarding dialysis in one of our previous videos. The more permanent measure for kidney failure is kidney transplant. So, in this, what we do is we take a functioning kidney from a donor and transplant it into our patient. It is preferred that the donor be a close relative of the patient so that the chances of the patient's body rejecting the new kidney is minimized. And it doesn't activate the immune system of the patient's body. The second scenario that can occur in a kidney is when there is inflammation of the glomeruli. Glomeruli is a tuft of capillaries that is found within our nephron, and that is where the filtration occurs. This condition is called as glomerulonephritis. So it means inflammation of the glomeruli that is present within the nephron. The reason for this condition occurring are many. It could be an infection, it could be due to autoimmune disease, or even certain diseases which affect the blood vessels in the body. So, if this is our normal kidney, we see inflammation along these regions of the kidney because that's where the nephrons are present. This condition can be treated by more than one method. So, if it is an autoimmune disease, we can give them immunosuppressants so that the immune system is controlled. We can also perform dialysis on the patient. But for any sort of kidney disorders, the most permanent solution is kidney transplantation. The final and the third scenario that we encounter in case of a kidney that's not functioning properly is when there is salt crystallizations in the kidney. This condition is called as a renal caliculi or simply kidney stones. The reason for kidney stones is accumulation of certain insoluble salts, especially oxalate salts within the kidney. There are multiple ways to treat this condition as well. If the stones are too big, people usually go in for surgery where these stones can be directly retrieved. On the other hand, there are also medicines which can slowly dissolve these stones over a long period of time. And finally, we also have the shockwave method where, let's say, we have a kidney stone. shock waves are directed at these kidney stones. Over time, what happens is that the bigger stones are fractured to smaller stones, and these smaller stones are then excreted while the person urinates.